Staying in Nigeria, the country has the highest burden of sickle cell disease in the world, with at least 40 million people as carriers, according to the World Health Organization. Now, Nigeria lawmakers have passed legislation that will help health officials better coordinate and supervise the prevention, control, and management of the sickle cell disease in the country. Sickle cell disease, which is also known as a sickle cell anemia, is an inherited red blood cell disorder which affects millions of people, mostly with origins in sub-Saharan Africa. Ihaza reports from Abuja.
Mr. and Mrs. Ohiomokhai lost Jephthah, their firstborn, at the age of 15 to sickle cell in 2017. Due to a faulty medical report, Senami Ohiomokhai says she didn't know she was a carrier of the sickle cell gene until she was already pregnant with Jephthah.
The test was done and the result came out and I was AS. I was shocked. How can I be? It's not possible. I'm AA, and my husband and I did the tests 2 other times and the result came back the same. And where I was AS, he was AS. And at this point, I threw the question back to you. What would you do? I'm married. I'm pregnant with my first son. There was no going back.
About 150,000 people die each year in Nigeria from sickle cell disease, passed on from their parents who also have it in their genes. The disease affects the red blood cells, causing fatigue and anemia, frequent and severe pain, and the breakdown of the immune system. Nigerian legislators have now passed a bill that would ensure people are tested for the disease. The legislation also prevents people who are carriers from getting married to other carriers.
Lawmakers say the bill is crucial if the country is to attain its sustainable development goals of good health, as well as drastically reducing the burden of sickle cell in Nigeria.
Mary Nwagba is a sickle cell survivor, and she runs an NGO that educates about the threats of sickle cell and how best to prevent it. Mary wants the government to share this kind of information more widely with the public.
Aside passing the bill, I believe what government should do is send an SMS, like in a day, 3 to 4 should be okay. By the time it gets to, with the BVN number and everything, by the time it gets to a lot of masses, people who don't even know will be asking questions. Oh, I got this message, I don't understand, though. Can you please explain? Someone who is knowledgeable will explain it to you. And another way I feel the government can help is through media.
In addition, equipping hospitals to provide better services is what some think the government should focus on.
Our medical facilities, we need to do something about getting the right results if we must nip this thing in the bud.
The government says it is prioritizing medical facilities across the country with a budget of about $250 million for next year. And such efforts could prevent many more families from experiencing the anguish of losing loved ones to sickle cell disease like the Ohiomokhais. Ihaza, CGTN, Abuja.